Okay, we're going to do squeeze, Thompson, bumps, Holman. Okay, good. Down. Just going to get down. So squeeze test. Horrible test. But we have multiple uses for it. So squeeze test can be used for a fracture through the tibia and the fibula. It can be used for a stress fracture through the tibia and fibula. And it can also be used for a syndesmotic. Actually, can you slide back a little bit? And the technique is pretty simple. Cuff technique. Squeeze, tib, fib, up and down. So obviously if I'm here and she has pain right there, you're thinking fracture or stress fracture, correct? If I squeeze here and she's giving me pain down in the syndesmotic, that's a syndesmotic sprain, because as I squeeze here, the tibia and the fibula gap and separate. Kind of like a tuning fork or a whatever. You know what I'm saying, right? So the idea is you squeeze here and it gaps it. If you look at the data, though, not great tests from an evidence-based standpoint. Okay, so they're not great tests, but that is squeeze test. It can be used for fracture, stress fracture, or syndesmotic, so you really need to have good communication with your patient about where their pain is located. Everyone with me? All right. Thompson test. Great test. Awesome test. 100% on everything. Thompson. This is for Achilles tendon rupture. It is so cool. And by the way, this has great evidence on it. And it is easy. You ready? So, I am going to squeeze her calf, her gastrocnemius. The physiological response should be what? Should have a little bit of plantar flexion. Okay? If you can't see it, you can actually put your hand right there and you actually feel, they'll actually move your hand. A Thompson test is positive where you will squeeze and it doesn't do anything. Okay? And it looks really weird. So you're squeezing, and the ankles are sitting right there like, do something. Obviously, this is sort of one of those tests like, why are we really doing this? Because you'll know when they blow out their Achilles. That's Thompson for Achilles. Don't confuse it with Thomas. Those are two completely different body parts. This is Thompson. Okay? Thompson with a P. Bump. What? So I think she may have a potential stress fracture or a fracture in her tibia or her fibula. All right, what? So what you do is you put her in dorsiflexion, you hold, and you hit or bump. The idea here being is if I bump here, it sends waves up the bone. And if there's a fracture there, what's that going to do? Not me. I mean, it's a little discomforting to me. That's why you make sure you hit with this part. All right? But that's the bump test for a fracture. Again, hopefully your medical history would have gotten to this part, so you don't need to do it. And you can actually just do it like this. Okay? You can be gentle. The idea here is that any sort of motion or movement is going to be causing pain. And I don't care about pain here at the heel. I'm looking for pain up there. Probably not going to get any fibula pain because it's not really the weight-bearing part. So you're not going to get a lot. It's more for tibial. All right? That is bump. Homans. Useless. Still going to do it. Homans is for DVT. Deep vein. Okay, fine. Everyone jump in there. Okay, so what we do here is prone or supine. Lie down. Go to happy place. So they're having numbness, tingling, burning in their calf. Typically, this is the calving. Okay. What we can do is we come up here, and we can kind of load the calf up. I like a passive stretch here. So we're putting a stretch on the gastroc. Agreed? And then we get the gastroc a little squeeze, and we get burning, radicular, radiating, ow pain going up and down. Basically, what we're doing is we're stretching that blood clot, and now I'm squeezing the clot, and that's going to fire everything up. Well, that's Holman's. Not the best test. Doesn't have good evidence on it, but that's Holman's. And then finally, percussion or tap. This can be used anytime you feel like they have a fracture, and it's just a little tap, 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 etc. This kind of percussing and tapping. I am not a fan of tapping directly over the fracture site. So if we think they've broke it here, I'm more, if I tap up here, do they have the pain there? Same idea as bump, right? I'm just kind of tapping the area and seeing those vibrations.